We are live, sir.
Okay.
Shall we start?
Yes, we can start.
Good afternoon, everyone. I'm Dr. Kirti Suta from Dr. Makkar's Diabetes and Obesity Center. Welcome to the session. The topic of today's session is, let's talk about mental and emotional health. When you find out that you have diabetes, it may leave you upset, confused, or sad. These feelings are really understandable, but then we need to focus on treating the body as it's the most pressing need of the day. But do you know this news can trigger intense feeling? And if you had diabetes for a while, you just know that it's the start of an emotional journey. And people with diabetes are more likely to have mental health issues like depression, anxiety. Tending to your emotional well-being will help you take better care of your physical needs too. So, dear friends, this session of ours is an effort to focus on mental and emotional health of the people with diabetes. Welcome, sir, to the session.
Thank you, Dr. Kirti. Good afternoon, everyone.
So my first question to you for the day is how to deal with this news of being diagnosed as a diabetic.
Very important question. There are two types of reaction that we commonly see. There is a group of people who, once they get diagnosed with diabetes, they feel shattered. They feel, something has grossly gone wrong. The life is going to change tremendously, and that is change is not going to be for good, and they will have to live a compromised quality of life and so on. But there is other group of people who just don't bother also. They have got diabetes. They feel that they are not having any problem. They are not having any symptoms. So just routine, checkup showed diabetes. It doesn't matter. And they know so many people who have diabetes for so many years, nothing happens and things like that. So there is a group which is over concerned, and there is a group which is in denial of the problem that something wrong has happened. Now, both are bad, but we'll focus on today who get shaken up by diabetes, feel frustrated, feel stressed, depressed. They feel something gross has changed. This disease is going to affect them badly. If it has happened early in the course of life, somewhere around 40s or 50s, everybody is in the middle of family life with lots of responsibilities to take care of in next 10 to 20 years. So they get scared also, what is going to happen, what is going to happen to the family, children, future, and so many things come to their mind. Now, important thing is, one thing that is missing in Indian setting is that people don't try to educate themselves about diabetes. Actually, once you have got diabetes, you have got diagnosed with diabetes, the first thing is you should try to get some knowledge, some information about diabetes, not from lay websites, from the authentic websites. You should read about it and also consult a professional person. Ask for professional help. That means you consult a physician and talk to him or her in detail that now, since diabetes has happened, what is going to be the course of action in terms of further testing, confirmation of diagnosis, treatment, lifestyle changes, and what is the prognosis, what is likely to happen over next 30, 40, 50 years. And if they are able to control diabetes well, is it actually going to be really compromised for long term? So there are so many things that they can learn. And if they understand this, they gather knowledge about diabetes, they gather, how to manage it properly, possibly that stress or that reaction will be very much, comfortable now. So information is very important, and that is, lacking in most of the people.
Sir, I'll take you back. You said people have two types of reaction. What, according to you, is better? or you need to have a balance of?
Denial is basically a suicide mission. If you deny that you have a problem, that means you are not going to take care of it. You are not going to monitor it. You are not going to do enough to control it well, and you are not bothered what is going to happen because you don't know and you don't want to think about that. So denial, what I call, is a suicide mission, that you are slowly moving towards the suicidal end. Now एक वो कहते हैं ना, बिल्ली चूहा अगर बिल्ली को देख के आंखें बंद कर ले तो क्या होता है? तो आंखें बंद करने से तो पक्का मारा जाएगा, बिकॉज बिल्ली खा जाएगी उसको. बिल्ली अगर दिख रही है तो आंखें खोल के बैठना बहुत जरूरी है, और ये पता होना चाहिए कि बिल्ली किस डायरेक्शन में जा रही है, so that you can save yourself. So it is very important not to be in denial mode. Diabetes, high blood pressure, all these are, uh, important chronic diseases of adult life, which once they are there for long term. You need to treat them, manage them for long term. You have to keep monitoring them, because they can cause very crippling or life threatening complications. They can increase the risk of early death also. So to prevent that, it is very important you identify them in time and immediately treat them. Don't delay. The longer is the delay in treating these things, the higher is the chance of getting complications. So denial is never good. One may have overreaction towards the diagnosis to begin with. That overreaction is also not good if it is going on long term. Important thing is, it is natural. You are walking on the street and you get hit by something, you will be startled for a while. But then you realize, now I am fine, the injury is not big and I can still walk, I have not fallen down, and it will heal up or we'll manage it. Then that stress comes down. Exactly that should happen in diabetes patients also. Okay, fine. Suddenly one fine morning you got the diagnosis of diabetes, you have got hit, you are startled, but then you gather information, talk to the doctor, understand how you can treat it. And now there are, early stage of diabetes, you can reverse it also. We have so many studies and so many options to work on reversal also. So there are many ways to bring down this reaction. And once you have enough knowledge, you know how to manage it, you are taking professional help, there is no reason why you should be in stress or depression because of diabetes.
So how is diabetes and mental health related?
So there is a bidirectional relationship. There are a lot of studies which have shown that people who have diabetes are at a higher risk of getting mental health issues like depression, like schizophrenia, dementia, and so on. At the same time, people who have mental health issues are also more likely to get diabetes. And another thing is that there are, antidepressants or medications used for mental disorders, which increase the risk of developing diabetes or precipitate diabetes also. So there is a, bidirectional link. If people have mental health issues, they're more likely to get diabetes. Those who get diabetes are more likely to get into mental health issues. And once there is, mental health compromise, the treatment or management of diabetes becomes difficult, because person who is mentally challenged because of depression or stress or whatever may not be, following all the advice that is given either by the uh, psychiatrist or psychologist or by the diabetes physician. So both ways the treatment may get affected.
Basically, you get trapped into that vicious cycle.
Yes.
So do you really think that we are lagging somewhere in the identification and acceptance of these mental health issues?
Absolutely. No, we are, most of the time we are not identifying these mental health issues in diabetes patients. And that is one of the reasons, the compliance to treatment or adherence to treatment is not very good. Second thing is, in Indian settings, somehow the practice is very different. Most of the physicians who are treating diabetes do not have sufficient time to devote to the patient to explain everything about diabetes, because of the number of patients that are being seen on a day-to-day basis, or the lack of team management for diabetes. You need to have a psychologist or dietitian or counselor who can take over the job of educating the patient, but that team does not exist. So everything is done by the treating physician, and the physician does not have time to explain everything, all details about exercise, about diet, and then come to mental health. So generally there is a minimal education given about diet and exercise, and mental health generally gets neglected. So it is most of the time it is not identified unless there is very very clear cut symptoms of mental health issues.
So how to deal up with this thing?
So to deal up with this thing, first thing is, I think, for the person who becomes diabetic, who gets diabetes and gets to know that he or she has developed diabetes, first thing is that there is no need to panic. See, if you are informed person, if you are informed about diabetes, you can manage it well, and you can get information from various websites. You can talk to your doctor, and important thing to understand is that diabetes does not kill you overnight or in a short span of time. In fact, diabetes never kills you if you are managing well. It is only the complications that cause compromised lifestyle and early risk of death. So if you have got diabetes, first thing is you have to adopt a healthy lifestyle, right? And adopting a healthy lifestyle is not just for diabetes. Everybody should have a healthy lifestyle. So if you have a healthy lifestyle, that unlikely that you will get diabetes soon, unless there is a strong family predisposition. So the very fact you have got diabetes, chances are that you have to look at your lifestyle, move towards a healthy lifestyle, move towards healthy eating habits, get information from valid sources that what is going to happen with diabetes. And once you understand that it is not going to compromise your quality of life significantly, if you adopt a healthy lifestyle, take your medications on time, and check your sugars on time, and make sure that you are in under control, then it is likely to take away all your stress, and you don't need to worry. And people with diabetes who are well controlled right from the beginning easily live 40, 50 years without complications also. It is not a big thing. Only thing is it is not to be neglected. So usual stress comes when person has got diabetes, then person started taking medication, then person wants that I have to stop medication, but these medication will give side effects. They, then we have so many uh, gurus who are self-styled diabetes experts. Everybody treats diabetes. You can get it on Asta channel. You can get it on TV sales channels. Everybody is selling cure for diabetes, and till date we have not found anybody getting cured of diabetes. In the process, people stop taking medication, stop monitoring their sugar levels, and end up with some serious issues. And once they realize that, okay, I have not been able to get rid of diabetes, then depression starts beginning. So if they have enough knowledge, right information, and that if they understand that diabetes is something with which they can live near normal life, then the reason for concern and the apprehension and stress and fear can significantly reduce.
Basically, it's just your mindset.
Yes, and information is very important. one should not try to stay ignorant of what is going to happen. So if you understand it well, you are able to manage it well.
So now let's talk about a very special situation. We are talking of if you are a diabetic, you have been diagnosed with diabetes. Let's say I talk about if my loved one is staying apart from me, it's somewhere else. So how to take care of that person with diabetes?
So
How to take
first thing is you don't need to take care of anybody's diabetes. If the person is well informed, and all person needs to do is to manage a decent lifestyle, is going for a regular walk, say 45 minutes to 1 hour, eating 3 meals on time, not missing meals, not going haywire with the eating habits, regular regular home cooked meals, or even if somebody is staying alone, ordering food from outside, can understand what choices can be healthier and what which are more unhealthy, and make the right kind of food choices, is able to follow a diet plan which is given or suggested by a physician or dietitian, and is able to monitor sugar regularly, that person does not need anybody's help to monitor manage diabetes, right? And if person is able to manage diabetes properly, person does not get depressed, does not get stressed, does not have any problem. And usually if somebody is following a healthy lifestyle and regularly exercising, they do better than people who don't have diabetes. In fact, there is a study, where it's a very long trial called Steno, and we have results after 21 years of follow-up of diabetes patients who were taking regular medications, checking their sugars regularly, taking regular medication for glucose, blood pressure, lipids, and everything. And after 21 years of treatment, the people who were regular with treatment and lifestyle interventions had a 8 years increase in lifespan compared to those who were not following. So imagine the quality of life is better, the longevity is increased if person is taking proper treatment. Now, second thing is, people feel that, sugar is high, so I am not able to do enough. I am not able to manage my diabetes. So there is, you don't, person does not have to blame oneself for diabetes management. Nobody is expert in diabetes management. Nobody's glucose levels stay in a very narrow range. Everybody's sugar levels fluctuate. But if they are happening within the reasonable limits, then there is no problem. And if the person is not able to get the sugar levels to a reasonable target, which is defined, which usually is defined by the physician and the patient together, patient should know what are his limitations in managing that level, then he can consult the doctor again. And till the sugars are in the target range, there is person should maintain regular follow-up. And after that level is achieved, usually you don't need to be visiting doctor every day. A 2 to 3 months follow-up is sufficient. Ideally, if you are regularly visiting your doctor, nothing better than that. You should be visiting your doctor every month or 2 months, just making sure that you are following the medication, nothing needs to be changed. Doctor also make sure that your parameters are doing fine, you are not moving towards any complication, and thank you. You should be visiting your doctor to stay healthy and to report that you are maintaining good health, not to report that you have got a complication. That should be the purpose of your management. So if somebody is doing well, there is no reason why one will get into that stress.
सर आपने जो बातें बोली हैं वो प्रूव करती हैं कि टेकिंग केयर ऑफ वन सेल्फ इज नॉट बीइंग सेल्फिश, जो आज हमने टॉपिक रखा है.
And taking care of oneself is not selfish at all. It is, first thing is, charity begins at home. You have to take care of yourself. If you are not yourself healthy, how will you take care of anybody else?
Yes. So you have proved it today. So there is a term, diabetes distress and diabetes burnout. Can you please explain and how to manage these?
Diabetes distress is usually, once person gets diabetes, gets frustrated, gets, you know, mm, that feeling of getting an illness overwhelms the person. You know, person feels that diabetes, now person has got diabetes, so whole life is shattered. So, and this feeling, this may be temporary or this may come intermittently. Whenever person has got bad control, the sugar levels have gone up, person feels, what the hell, I am again repeatedly having this problem. So these may be feelings may be coming intermittently, and then person visits the doctor, sugars are fine, he is doing fine, does not have any symptoms, forgets after a week, that there is a problem. So distress can be temporary, and usually if it is temporary, it is a normal feeling. It can happen to anybody because of some other reason also. It is not necessarily diabetes, but once it is related to diabetes, and that feeling of having that diabetes is an important illness is life, is kind of overbearing on your mindset, and you are perpetually disturbed with that for few days, or then it is diabetes distress, and this can be longer. Now burnout is a situation when you are kind of perpetually stressed because of your diabetes, and you get into that negative mode that I cannot do anything, nothing is going to happen, and people stop taking their tablets, people stop taking insulin. What the hell, I am not going to inject myself till the rest of life, I am not going to do it. So those things can happen. So that is what is diabetic burnout, that you are totally kind of overwhelmed by the diabetes and issues related to diabetes. But I think it is very important that person should keep a positive mindset, should keep discussing his problems, his stress, or his or her stress, or any problems relating to diabetes with the treating physician. Regularly visit the physician, so make sure that everything is on track. If there are some issues, they can always search help on net. They can be part of online forums where these discussions are going on, and people can find simple solutions for their routine problems in the discussion forums also. And another important thing is, people don't realize that a simple regular walk is actually a good stress buster. So a regular exercise and maintaining a healthy lifestyle actually brings down stress significantly. And of course, if nothing is working, they should ask for professional help. They can consult a psychologist or psychiatrist, whatever is required. So a teamwork is required usually for diabetes management, which includes mental health as a component of management.
So any other tips you would like to give, how we can improve, take care of or improve our emotional health?
So I think first thing is that we have to understand what diabetes is. So diabetes is a lifestyle disease like blood pressure, like overweight, which results from strong genetic predisposition and the right combination of bad genes and bad environmental factors, which include your lifestyle, precipitating the disease. Now, it is, when I say bad lifestyle factors and bad genes, it is nobody's fault. Genes are, there, nobody gets genes by choice. Now, those genes, if they have predisposition to get diabetes, you are exposed to an environment which is conducive to development of diabetes, you will get diabetes. Now, the same genes may not give you diabetes if you are in a very healthy environment, you are regularly exercising, you are regularly maintaining a good healthy eating habit, maintaining normal body weight. These genes may express very mildly, or may not express, or may express much later than they would express in the bad environment. Now, second thing is, people think that this is under my control and I can change it. And because of that, they start blaming themselves also for their bad sugar control. In fact, the term bad glucose and good glucose should not be used. It is only glucose is a value. It is high or low. Now you have to keep it in range. As long as you are keeping it in that range or near that range, plus minus, you should be happy. Once it is going high, it does not mean that you have committed a sin. That is why it has gone high. It is normal that once in a while you have eaten outside, it will go high. No problem. Next 2 days you keep monitoring and maintain a normal diet and exercise. It will come back to normal, and make sure you are taking your medication. So self-blaming, uh, negative feelings, depression, those are things that start happening if you don't handle your sugar values well. Sugar values are never in perfect range in any diabetes patient. Everybody will have some or more, somebody will have higher fluctuations, somebody will have lower fluctuations. And in fact, there are people who are so obsessed with the sugar values that they repeatedly go into low levels, repeatedly get into hypoglycemia, which is actually bad, which is worse than having, small fluctuations going on the hyper side. So you have to understand that what should be your sugar level, and don't need to blame yourself for everything. Not everything is under one's control. Somebody may be very good at maintaining a healthy eating habit, but the brain is programmed to trigger more eating on sight or smell of some particular foods. Now person thinks that this is just person's weakness, but it is not so. This is something called hedonic or pleasurable eating, which is again controlled by hedonic centers in brain. So there are a lot of things which do not happen because of person's bad habits or bad behavior. There are multiple mechanisms involved in that, so person need not blame oneself and get stressed because of that or depressed because of that. So maintain a positive attitude. Try to gather as much information as possible from valid sources. Maintain a healthy lifestyle. Make sure you go out for exercise or walk every day. That will bring down your stress. That will bring down your sugar levels. Keep a healthy lifestyle. And of course, if you have slightest of the problem, always talk to your treating physician or seek mental health professional help. Nobody is stopping you, but don't sit in the room and keep cursing yourself that something has gone wrong and you have done it. So whenever you need help, you should take help. Managing diabetes is not very difficult if you follow some simple principles, and most of the patients are able to take care of this diabetes stress by simple adjustments. Talk to your friends, talk to people who have diabetes, keep talking to your family members, join the discussion forums. There are so many things that one can do.
There has to be an identification, acceptance of the problem, and then working for the problem.
One is acceptance. First is you identify the problem. Second, accept it. Third thing is you have to accept that this is not the end of life.
Yes.
This is something which is very much manageable, and you can live almost a normal life with this problem. So if you understand that, I don't think there should be a major issue with the mental health, and most of the patients are able to cope up with that.
Perfect. Sir, in the end, I would just like to say that mental health is also very, very important as physical health. And we, as a patient, as a caregiver, as a healthcare professional, we should identify it and we should try to help ourselves or the other person as much as possible. We just need to have acceptance. We need to talk about it and we need to work on it.
Absolutely.
So
And it is something which is very easily manageable. You have to start taking it in the healthy spirit.
Yes. Right. So thank you everyone for joining with us. Stay home, stay safe.
Thank you everyone, and hope to see you again next week on Thursday, 3 p.m. Thank you.
Thank you.